Tomorrow officially starts off Heart Disease Awareness Month, and here today to talk about how to keep your heart healthy is Dr. Rachel Berger. She's a cardiologist at Virginia Heart, and welcome to the show. Glad to have you. This is a big deal, especially when it comes to us women.
Absolutely. And we're starting off Women's Heart Month for the month of February. And we're really trying to raise awareness that this is not just a man's disease. This is a disease that affects everyone, regardless of race, gender, ethnicity.
And so many times we hear men, women, anybody, that you have a symptom and you think, I'll be okay, it's probably this, and we don't get checked out.
And that's one of the most important things to know, is that you need to know your own body. You need to know your symptoms, and you need to know when things just don't feel right, and you need to be your own advocate. So that means going to see your doctor if things feel a little funny, and especially for women who often present differently than men with heart disease. They may not present with clutching chest pain. They may present with shortness of breath, or just not feeling right, or feeling tired, or back pain, that they really need to be their own advocate.
The stats in the U.S. each year, more than 500,000 people dying in the U.S. from some kind of heart disease. That's big.
It's huge. It's huge. 1 in 3 will die of heart disease or stroke. And it's huge. It affects everyone. Everyone has someone in their family that's affected by heart disease, and there's so much that you can do to help prevent it.
Let's talk about, and I'm not sure many people know about this unless they've suffered from heart disease or have someone they're helping get through this, but there's many different conditions when it comes to heart disease, like hypertension and coronary heart disease. Talk to us about this.
So heart disease encompasses a number of different things. It encompasses, what we think of as heart attacks or coronary artery disease, which really has to do with the plumbing in the heart. It has to do with blockages in the blood vessels that supply blood and oxygen to the heart muscle. And for that, we really target the things that you can do to help prevent the development of those blockages. So things like getting your blood pressure under control, getting your cholesterol under control, eating a heart-healthy diet, exercising, getting your weight in order, and not smoking. I mean, those are the main things that you can do to help minimize your risk of developing those blockages.
You always hear to know your numbers. Know your numbers when it comes to both of those things. So explain that.
Everybody should know their numbers. They need to see doctors regularly. Often that starts with your family practitioner or your primary care provider. And when we say knowing your numbers, it's knowing your blood pressure, knowing your cholesterol, knowing your blood sugar, knowing your weight and your body mass index, and knowing what your goals are. So people are different depending on who they are and what their medical history is and what their family history is. And so people may have different targets for those numbers, but knowing where you're at and what your goal is crucial in taking good care of your heart.
Let's talk about the what ifs. If you don't have the good numbers, a lot of us can, go to the drugstore, you could do the whole put your arm in and get that blood pressure. And if you're shocked by what you see, you compare it to the diagram, what's the first step you can do for yourself?
Well, there are two things. One is you should see a doctor. If your numbers are high, you should see a doctor, and they may tell you, let's work with your lifestyle and see what we can do to get your numbers down. Or they may say that you need medication to get those numbers down.
But there are things you can do at home, and what are those?
Absolutely. So it starts with diet. So watching your diet, eating a low-salt diet, and we forget that salt is not just what we add on top of our food, but it's what's in our food. So it's processed foods, canned foods, frozen dinners, filled with salt, and that is directly linked to elevated blood pressure. So watching your diet and exercising. So being active, doing at least 30 minutes of physical activity most days of the week, getting your heart rate up, however that may be.
It's the easy stuff we know about, but it's the hard thing of getting there and actually doing it.
Absolutely.
Yeah,
Absolutely.
Well, these are all great tips, and tomorrow being the kickoff to this special month, a big deal. So, Doctor, thank you for coming in and telling us about this.
My pleasure. Thank you for having me.
Of course.